Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A, in this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gynecologic oncologist talking to a patient called Anna Pearson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Pearson. I've reviewed some notes from your recent checkup, and I see you've had some troubling symptoms. Could you walk me through what's been going on, in your own words?
Sure. I've been feeling really bloated lately, and it doesn't seem to go away no matter what I eat. And I have this constant dull pain in my abdomen, mostly lower down. I thought it might be indigestion at first, but it's been weeks, and it's just not getting better.
I see. Has the bloating or pain affected your daily life in any specific ways?
Yes, actually. I've noticed that I feel full very quickly when I eat, which is strange because I used to have a big appetite. Now I can barely finish half my meal without feeling stuffed. Also, I'm tired all the time, just this deep fatigue, even after a good night's sleep.
That sounds quite uncomfortable. Besides the bloating, pain and fatigue, have you noticed any other changes? For example, any changes with your weight or your menstrual cycle?
Well, I've lost a few pounds, but it was unintentional. I haven't been dieting or anything, and my periods have become a bit irregular. I didn't think much of it. At first, he figured it might just be stress.
That's understandable. It's common for these symptoms to be mistaken for something less serious. Do you have any family history of cancer or any major health issues that you're aware of?
Yes, actually. My mother was diagnosed with breast cancer when she was in her 50s. She's in remission now, thankfully. But, as far as I know, no one in my family has had ovarian cancer specifically.
Family history of breast cancer can still be relevant, particularly if there are shared genetic factors involved. Just to clarify, you haven't experienced any spotting or unexpected bleeding outside your usual cycle, correct?
No spotting or anything like that. Just the irregularity in my cycle timing. But I have felt some pressure in my lower back, which is new for me.
Thank you for sharing all of this. The symptoms you've described, bloating, feeling full quickly, abdominal pain, and fatigue, are sometimes seen in cases of ovarian cancer, though they can overlap with other conditions too. Since you have a family history of breast cancer, I'd like to take a closer look at this to rule out any underlying concerns.
I see. So, what kind of tests should I expect?
To start, I'd recommend a pelvic examination so I can feel for any unusual lumps or tenderness. We'll also arrange for a transvaginal ultrasound to get a detailed look at your ovaries and surrounding tissues. This ultrasound allows us to detect any abnormal growths or changes.
Okay, that makes sense. And what would the ultrasound show exactly?
The transvaginal ultrasound can provide images of your ovaries, fallopian tubes, and uterus. It helps us see if there are any cysts or solid masses that could be causing your symptoms. Additionally, I'd recommend a blood test to check for something called CA-125, which is a protein marker often elevated in ovarian cancer.
I've heard of that test before. So, Does a high CA 125 level mean I have cancer?
Not necessarily. Elevated CA 125 levels can be caused by several benign conditions, such as endometriosis or pelvic inflammatory disease. However, it can provide us with valuable clues, especially when combined with the ultrasound results. If we find anything concerning, we may suggest a CT scan for a more comprehensive view.
I understand. And I guess I just want to know if this is ovarian cancer, what happens next?
If we do detect ovarian cancer, we'd first confirm it with a biopsy, which involves taking a small tissue sample. From there, treatment options typically include surgery to remove any affected tissues, and in many cases, chemotherapy is also recommended to target any remaining cancer cells.
All right. And how involved is the surgery?
It varies based on the cancer's stage and spread. Early-stage cancer may only require removal of the affected ovary, while more advanced stages might involve a more extensive procedure to remove additional tissues or organs affected by the cancer. We'd discuss the best approach for your case after the initial tests.
I appreciate you explaining all of this. It's a lot to take in, but it helps to know the steps.
Absolutely. I want you to feel fully informed. We'll proceed with these initial tests and meet again to go over the results and the best way forward. In the meantime, please feel free to reach out if you have any more questions or concerns. I'll do everything I can to support you.
Thank you. That gives me some peace of mind.
You're welcome, Miss Pearson. We'll be in touch shortly to schedule your tests, and we'll take this one step at a time.
Extract 2, questions 13 to 24. You hear a neurologist talking to a patient called Mr. Amit Patel. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, please come in. Are you Mr. Amit Patel?
Yes, that's right.
Amit, I understand you've come in today to discuss some recent health issues linked to polio. Can you tell me a bit about what's been going on?
Yes, it's been quite a journey, really. I contracted polio as a child, but I've mostly been fine since then. Lately, though, I've been feeling a lot of fatigue, and my muscles feel weaker, particularly in my legs. I didn't think polio could still affect me this way, so many years later.
I can see why that might be surprising. It sounds like you might be experiencing what we call post-polio syndrome. For some people, symptoms can resurface years or even decades after the initial infection. How long have you been noticing these symptoms?
It's been about a year now. At first, I thought it was just getting older. I'm 52 now, but it started affecting my daily routine. Sometimes I struggle to walk up the stairs or even get up from a chair, and I'm exhausted by midday. It's frustrating because I've always been fairly active.
I understand. Many people with post-polio syndrome report similar experiences, and the onset can indeed be gradual. Besides the fatigue and muscle weakness, have you noticed anything else unusual, like changes in your ability to perform specific tasks?
Actually, yes. I used to play the piano for my family gatherings. Recently, my fingers feel stiff and my hand strength isn't what it used to be. Even holding a glass of water can be challenging at times. I've also started to notice some pain in my muscles, especially after physical activities.
That's helpful information. Pain and muscle stiffness can accompany the syndrome, especially after exertion. Let's go over your medical history. Any other conditions or medications you've been taking recently?
Nothing major, thankfully. Just a bit of hypertension, for which I take medication daily. Other than that, it's really just this muscle weakness and fatigue that's been holding me back lately.
Understood. When you were first diagnosed with polio as a child, did you experience any long-term effects or mobility issues growing up?
Yes, I had some difficulties with my left leg when I was younger. My parents got me a brace and I had physiotherapy sessions for several years. Thankfully, I was able to walk normally after a while and didn't need any aids as I got older.
That's great to hear. Many post-polio syndrome cases are characterized by a similar history, a long period of normal function followed by a gradual return of symptoms. It sounds like you managed well with the initial effects. How has this recent onset impacted your life? Are there activities you've had to stop or change?
Well, I'm a primary school teacher, and staying on my feet is a big part of my day. Now, I find myself needing to sit more often, and I sometimes feel unsteady when I walk. It's also affecting my social life. I used to love going for hikes and outdoor activities with friends, but now I'm hesitant to join because I worry I might not keep up or might get too tired.
That must be difficult. It sounds like your quality of life has been affected quite a bit. One of the challenges of post-polio syndrome is balancing activity to maintain strength without overexerting muscles that may already be fatigued or weakened.
I see. I've been pushing myself to stay active, hoping it would help, but it seems like I just end up more exhausted afterward.
That's actually quite common. In cases like yours, physical therapy that focuses on gentle strengthening exercises rather than high-intensity activity can sometimes be beneficial. The goal is to find a balance that maintains mobility without worsening fatigue. Additionally, there are some lifestyle adjustments and aids that might be helpful.
That makes sense. I hadn't considered using any aids, but if it helps, I'm open to it.
Absolutely. Some patients find that periodic use of a cane or a lightweight brace can ease the strain on certain muscles, especially on longer walks. It can give you more control and may alleviate some of the fatigue. We can also explore energy conservation techniques, planning activities to avoid overexertion.
That sounds promising. I'd appreciate any guidance on that. I've been feeling like I need a plan to manage this better, especially with teaching.
Of course. I'll refer you to a physical therapist who specializes in post-polio care, and they can create a program tailored to your needs. Also, staying connected with support groups or individuals facing similar challenges can be beneficial.
I hadn't thought of that. It'd be nice to speak to others who understand what this is like.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear nurse's discussion with a patient. Now read the question.
Sam, I wanted to discuss something I noticed in Mrs. Keller's file. She's the patient with the post-operative wound on her lower leg.
Oh, yes, I know which patient you mean.
I saw that the wound dressing wasn't changed as scheduled yesterday.
Yes, her wound looked stable the last time I checked, so I thought we could skip that dressing change.
Well, that could compromise the patient's healing and goes against the physician's order to change the dressing daily. I'm concerned that you're not following the physician's order, which could put patient safety at risk on other shifts as well.
Now look at question 26. You hear 2 colleagues talking to each other. Now read the question.
From last week. Has he been drinking more fluids like we suggested? That sometimes helps with his veins.
Yes, he has, but he's still pretty anxious. He's tried to relax, but he's not looking forward to this.
Right. I think a warm compress might help too, and maybe we can distract him a bit while we're drawing. Has the doctor specified any changes to the lab tests?
No changes, just the regular panels, but I think some extra reassurance might go a long way.
Okay, I'll bring some supplies, and we can chat with him a bit first to help him relax.
Sounds good.
Now look at question 27. You hear a researcher speaking to a colleague about microRNAs in cardiovascular development and disease. Now, read the question.
So, microRNAs play a critical role in heart development. They're essentially small RNA molecules that help regulate gene expression in cells.
Right? I've read they're involved in various cellular processes.
Exactly. In fact, they've emerged as significant players in both heart development and disease progression. Certain microRNAs can either promote or inhibit pathways that contribute to cardiovascular health or disease.
Interesting. So understanding their function could really lead to some breakthroughs.
Absolutely. Unraveling how these microRNAs work might help us create new therapies that target specific genes linked to heart diseases.
Are there any treatments available now that use this approach?
Not quite yet, but there's a lot of ongoing research. The potential is huge, though, especially for personalized medicine.
Now look at question 28. You hear an environmental health specialist speaking to a colleague about factors affecting public health. Now, read the question.
We're seeing an increase in respiratory issues, likely tied to the recent spike in air pollution levels.
That's concerning. Should we log this data for respiratory cases, or is it more urgent to focus on the endocrine disruptors?
Let's make a note of the respiratory cases for now, but actually, I think we should prioritize recording the cases related to endocrine disruptors. We've noticed a rising trend in reproductive health concerns lately. After that, we'll need to prepare the climate change report, as that data is required by the end of the month.
Understood. Do you need me to pull data on recent infectious disease rates too?
Yes, but let's focus on the endocrine data first, since that's time-sensitive. Then we can move on to the climate and infectious disease data.
Now look at question 29. You hear an intern asking a senior colleague about a patient's rehabilitation plan following a stroke. Now, read the question.
I noticed that Mrs. Adams hasn't been able to move her right arm much since her stroke. I know that early motor exercises are crucial in post-stroke recovery, but...
You're absolutely right. Early exercises help in regaining motor function and preventing further muscle atrophy. The rehabilitation team has been trying to engage Mrs. Adams in simple movements, but she's still experiencing significant weakness in her right arm. I've instructed the physical therapists to focus on passive range of motion exercises for now, like gently moving her arm with assistance, to maintain flexibility and prevent stiffness. Once her strength improves, we can gradually increase the intensity of her rehabilitation exercises. It's essential to start these early interventions to optimize her recovery and prevent complications like contractures or muscle wasting.
Now look at question 30. You hear an oncologist discussing an optional training. Now read the question.
Beth Green, an oncologist specializing in gastrointestinal cancers, with a particular focus on colorectal cancer. Today, I want to talk to you about why participating in our training on immunotherapy for advanced colorectal cancer is crucial. Immunotherapy represents a groundbreaking area in cancer treatment, and although it's been extensively explored in other types of cancers like melanoma and lung cancer, its application in colorectal cancer is only recently being developed. For patients with advanced colorectal cancer, immunotherapy provides a promising, yet complex, treatment avenue that requires careful patient selection and monitoring. At this hospital, we're one of only a few national centers advancing research and treatment in this area. To share our insights, we've designed a specialized training program specifically for healthcare teams involved in managing advanced colorectal cancer cases.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a presentation by a GP discussing social prescribing in healthcare. You now have 90 seconds to read questions.
Hello everyone, my name is Dr. Claire Edwards, and I'm a general practitioner at Riverside Health Centre in Leeds. Today, I'd like to introduce you to a concept we've been using recently in our practice called social prescribing. This approach allows us to look beyond traditional medicine when it comes to improving patients' overall health and well-being. We know that many health conditions are impacted by more than just physical factors. Mental health, lifestyle, and social issues play a big role too. Social prescribing helps us address these by connecting patients with community resources like exercise classes, gardening clubs, art therapy, and support groups. Social prescribing is particularly beneficial for people with chronic conditions, mental health issues, or social isolation. Imagine a patient who's struggling with loneliness or a sense of disconnection. Studies have shown that chronic loneliness can increase the risk of health issues like heart disease and even early mortality. Instead of only relying on medication or regular consultations, social prescribing allows us to recommend activities that can boost the patient's mental and physical health through social interaction and community involvement. Let me give you an example. I recently had a patient named Sarah, who had been dealing with anxiety and mild depression. Sarah felt isolated and rarely left her home. After discussing her situation in detail, we agreed that participating in a local community art therapy group might help. At first, she was hesitant, but after a few sessions, Sarah not only felt more connected to others, but also noticed a significant reduction in her anxiety symptoms. Now, she looks forward to her weekly sessions, and we've even reduced her dependency on medication. Social prescribing isn't limited to mental health though. we're finding that it's also helpful for patients with chronic physical conditions like diabetes or high blood pressure. Lifestyle changes such as regular exercise and better eating habits are crucial for managing these conditions, but they're not always easy for patients to adopt alone. By recommending group exercise classes or even a walking group, we create a social environment that encourages patients to stay engaged and motivated. This, in turn, can improve their long-term health outcomes and reduce the need for frequent medical appointments. In a typical social prescribing setup, a link worker, or social prescribing coordinator, acts as a bridge between the patient and community services. Link workers meet with patients to discuss their interests and needs, and then connect them with local resources that align with their goals. For many patients, this personalized support makes it easier to take that first step towards lifestyle changes that ultimately benefit their health. A large part of the success of social prescribing comes from patients feeling empowered. For example, Sarah shared that her self-confidence increased as she continued attending art therapy, and she felt more in control of her mental health. Many patients who've tried social prescribing tell us they appreciate having a say in their treatment plan, especially when they can choose activities that resonate with their interests. We're also starting to see evidence that social prescribing may reduce dependency on conventional medical services over time. Patients who are socially engaged and supported often report feeling healthier and requiring fewer GP visits. Of course, social prescribing isn't a replacement for medical treatment, but rather an additional tool that can complement traditional healthcare. For some patients, we still rely on traditional approaches, especially when dealing with acute health issues or when privacy concerns are paramount. However, social prescribing has the potential to be a valuable part of healthcare, focusing on preventive care and a holistic approach to well-being. So, in conclusion, social prescribing is a forward-thinking approach that addresses the broader aspects of health by engaging patients in their communities. We hope that as more people become aware of these resources, social prescribing can expand to benefit even more patients across the country.
Extract 2, questions 37 to 42. You hear a health talk with Dr. Carter. Now, read the questions. You now have 90 seconds to read questions.
Welcome everyone to Health Talk. Today, we're exploring a deeply complex and often polarizing topic, abortion. Joining us is Dr. Susan Carter, an obstetrician gynecologist and ethics advisor. Dr. Carter, thank you for being here.
Thank you for having me. I'm glad to provide insight into both the medical and ethical sides of this important issue.
Let's start with the basics. Could you explain what abortion entails from a medical perspective?
Certainly. Abortion, in medical terms, is the termination of a pregnancy before the fetus can survive outside the womb, generally around the 20th to 24th week. Medically, there are different procedures, including medication and surgical options, depending on the stage of the pregnancy and the specific needs of the patient.
Abortion is often considered controversial. What are some of the main ethical concerns surrounding it?
Well, on one hand, abortion raises ethical concerns about the sanctity of life. Some people view the fetus as a human life from conception, arguing that terminating it equates to taking a life. On the other hand, there are arguments supporting the autonomy of the pregnant person, emphasizing their right to make choices about their own body and life circumstances.
How do medical professionals approach these ethical concerns when treating patients?
It's a delicate balance. Many professionals approach the issue by focusing on patient-centered care, meaning the patient's well-being is the top priority. Medical teams ensure patients understand all their options and receive unbiased, comprehensive information. For instance, in situations where the mother's life is at risk, prioritizing her health is generally accepted in the medical community.
Could you elaborate on the situations where abortion might be considered medically necessary?
Absolutely. There are cases where continuing the pregnancy could pose a severe health risk to the mother, such as in cases of severe preeclampsia, or when the fetus is diagnosed with conditions that are incompatible with life. In such cases, the medical team may recommend abortion as an option to protect the health or life of the mother.
And are there restrictions around who can access abortion services?
Yes, access to abortion varies widely depending on legal restrictions, which differ by country and, in some cases, by state. For instance, some regions require mandatory counseling, waiting periods, or parental consent if the patient is a minor. In places where abortion is heavily restricted, patients often face additional barriers to accessing safe services.
Moving beyond the medical, let's consider the ethical argument that abortion is akin to taking a human life. How do proponents of this view argue their case?
This viewpoint is often rooted in the belief that human life begins at conception, meaning the fetus has moral status from that moment. Some people hold religious or philosophical beliefs that prioritize the fetus' right to life over the mother's choice, arguing that abortion is, therefore, morally unacceptable.
And, on the other side of the argument,
advocates for abortion rights argue that the autonomy of the person carrying the fetus is paramount. They highlight scenarios where forced continuation of pregnancy could lead to physical, emotional, or economic harm. Supporters often view the decision to terminate a pregnancy as a deeply personal choice, and believe that each individual should have the freedom to decide what's best for their own circumstances.
have any recent advancements in medicine or science influenced the debate on abortion?
Yes, advancements in fetal viability and prenatal testing have added complexity to the debate. For instance, as neonatal care improves, the point at which a fetus could survive outside the womb has shifted slightly. Additionally, prenatal testing has allowed for earlier and more accurate diagnoses of fetal health issues, which can affect decisions around abortion.
How does society at large influence a person's experience and choices related to abortion?
Society plays a big role. Cultural, religious, and familial beliefs often impact a person's perception of abortion, sometimes resulting in shame or stigma. In places where abortion is less accepted, people may be less likely to seek information or support, potentially leading to unsafe practices.
Finally, Dr. Carter, how can healthcare professionals best support patients navigating such a difficult decision?
It's crucial that healthcare providers remain non-judgmental and empathetic. They should create a safe space for patients to discuss their concerns and options without pressure or bias. Providing accurate information and mental health support can be life-changing, ensuring patients feel respected and supported no matter their decision.
Thank you, Dr. Carter, for shedding light on this sensitive and important issue. It's been enlightening to hear both the medical and ethical perspectives on abortion.
That is the end of Part C. You now have 2 minutes to check your answers.